Okay, so hand hygiene. We do med check 1. Here's my MAR. The doctor has ordered for Elena Pernoski, date of birth 9/18/36. She's allergic to penicillin. He has ordered 1 pill of Docusate, 100 milligrams daily, 1 tablet of a multivitamin daily, Metoprolol XL, 50 milligrams daily, furosemide, 20 milligrams daily, and an injection of enoxaparin, 40 milligrams daily. So I'm going to get that from my medicine cart. Okay, now I've got here my Docusate, 100 milligrams daily. Does not expire today. I have my multivitamin, 1 tablet daily. Does not expire today. Metoprolol XL, 50 milligrams daily. Does not expire today. Furosemide, 20 milligrams daily. Does not expire today. And my enoxaparin injection, 40 milligrams. Does not expire today. I'm going to close that. Here's my medicine cup. I'm going to put so I'm going to scan my metoprolol, 50 milligrams daily. Put it back into the medicine cart. Going to scan the multivitamin. It's just 1. This is med check 2. Furosemide, 20 milligrams daily. My Docusate, 100 milligrams daily, just 1 tablet. And my enoxaparin. Okay. And this resumes med check 2. I will do med check 3 at the patient bedside. Okay, so knock knock. Hello, I'm Carmen. I'm going to be the nurse today that's going to be taking care of you. Could you verify your name and date of birth for me, please? Okay. Is your name Elena Pernoski? Date of birth 9/18/36. Okay, thank you. Okay, now I'm going, oh, your phone's ringing. You want to get that? Okay. Hello, yes, I'm Carmen. I'm the nurse that's going to be taking care of Miss Pernoski today. Who am I speaking with? Anya Smirnov. You're the daughter. Okay, I see here that you're the designated medical power of attorney for Miss Pernoski. I have a picture of you here to identify you. Okay. I can discuss her care with you. I'm going to have you on speaker so you can translate for us since she does not speak English. Thank you. Okay, Miss Smirnov, can you hear me? Yes? Okay. Can you please let your mother know that I'm going to be performing a physical assessment on her and then giving her medications for today? Okay, thank you. Now, I'm going to do hand hygiene. Okay. Now, I'm going to begin by examining her head and her scalp. Okay. She was admitted for syncope. She was found on the floor and change in mental status. So I'm taking a look at her and see if she injured her head. There's also a CT scan that has been ordered for her. Okay, her head looks fine. Okay, I'm going to be taking a look in her eyes. I'm going to check her pupil dilation. Okay. Okay. I'm going to look in her ears. Okay. Can you tell her to follow my pen light without moving her head? Okay. I'm going to take a look at her nose. Okay. Can you tell her to open her mouth for me? Stick out her tongue. Okay. Miss Smirnoff, does she have all her teeth, or does she wear dentures? She has all her teeth. Okay, good. I'm going to feel for her lymph nodes now. See if there's any swelling. Okay. I'm going to pinch the skin here for skin turgor. Okay. Can you tell her I'm going to listen to her heart, please? Okay, good. Now I see in her chart, Miss Smirnoff, that she has congestive heart failure and coronary artery disease. So I'm going to take a look at her carotid artery. Can you have her turn her face for me, please? Thank you. Okay, I'm going to listen, see if I can hear anything. Okay, no bruit noted. Now, could you please let her know that I'm going to listen to her lung sounds, if she can take deep breaths for me? Okay, good. Can you tell her to sit up for me so I can listen to her lungs on her back? Okay. Okay, nice deep breath for me, please. Okay. Breathe in, breathe out. Okay, good. Okay, now I'm just going to take a peep at her backside now. Make sure that there isn't any irritation. Okay, everything looks good. She can lie back down. Thank you. Now, could you tell her if she could raise her arms up over her head as far as she can? Okay. Can you tell her to lay out her arms straight in front of her? Okay. Can she push up on my hands? Okay. Can she push down on my hands? Okay. Can she squeeze my hands? Okay. Very good. I'm going to check her cap refill. Okay. Good on the right hand. Good on the left hand. Okay. Now I'm going to take a look at her belly. Okay. I'm going to listen to bowel sounds. Okay, bowel sounds active in all 4 quadrants. Can you ask her when was the last time she voided, that she urinated? Okay, today. Okay, thank you. Can you ask her when her last bowel movement was? Okay, yesterday. Okay, thank you. Now I'm going to check her legs. Okay, can you tell her to lift her right leg for me and push up? Okay, can she push down? Okay, can you tell her to lift her left leg. Okay, and push down. Okay. Okay, I'm going to remove her socks. Okay, I'm going to check cat refill on her toes. Good on the right toe, good on the left toe. Okay, no edema on the feet. Skin color is good, skin temperature is good. I'm going to put her socks back on her. She's wearing non-slip socks because she is a fall risk. She also has a fall risk band. Okay. Okay, now I'm going to do hand hygiene. Okay, the next thing I'm going to do is I'm going to give her medication. Now, most of them are in pill form that she's going to take by mouth, and one of them is an injection. Do you know if she has any trouble swallowing pills? No? Okay. All right, now I see here that they've got an IV going for her. It is 0.45% of sodium chloride. It's 1,000 milliliters to go over 12 hours, and it expires not today. Okay, very good. Okay, just checking all of that is good. Okay. All right. So before I give her medications, because some of these, it's important to have her blood pressure taken currently, so I'm going to go ahead and take her blood pressure before I give them. Okay, now I see she has an IV here. It looks fine. It's clean, it's dry, no leaking, no redness. Can you ask her on a scale of 0 to 10 if she can rate her pain? Okay, 0, no pain. Okay, that's good. Okay, so I'm going to check her blood pressure. We may want to use the other arm since she's got an IV on that one. Okay. Okay, relax your arm. Okay, I've got 130 over 80. That's good. Okay. Now I'm going to check her pulse. Okay, good. I've got 80. Okay, so her vital signs were taken this morning at 4:30. Everything looks good. Now I'm going to proceed with giving her medication. So here I have her medications. She's going to be taking one multivitamin. It's just a supplement, no known side effects. Then she's going to take one tablet of Docusate, 100 milligrams. This is a stool softener. It's used to treat and prevent constipation. Some of the side effects that she may have is abdominal cramping and diarrhea. She's going to take one tablet of Metoprolol XL, 50 milligrams, once daily. This is a hypertensive medication. It is used to treat chest pain and high blood pressure. Now, one of the things that Ms. Roselle told me was that hypertensive medications that end in LOL are beta blockers, and beta blockers affect the heart and blood flow. This is an XL, which is an extended release. So we cannot crush this, she cannot chew this, she has to take this whole. Some of the side effects on that are also headache, blurred vision, nausea, vomiting. And she's going to take 1 tablet of furosemide, 20 milligrams, once daily. This is a diuretic, and it is used to help you make more urine and lose salt and excess water from the body. And it's used to treat high blood pressure, edema, or swelling. Some of the side effects of this medication is also nausea and vomiting, blurred vision, headache, and dizziness. With furosemide, because it's a diuretic, one of the lab values that is important to monitor and to know before you give it is potassium, because potassium helps regulate the heartbeat. Okay, and then she's going to have 1 injection, 40 milligrams of enoxaparin. This is used to prevent DVT, blood clots in the legs, because the doctor has ordered her bed rest. She's a fall risk. So we give her this subcutaneous in the love handle, and this has been ordered for her once daily. Now, there aren't any lab values that are really important to know for this one, because it's not heparin. It's a low molecular type of heparin. Okay, so if you can please tell her to take these pills. Here's her water. Okay, thank you. All right, I'm going to do hand hygiene. Okay, I'm going to put my gloves on. One of the things Ms. Roselle told me about the enoxaparin is this is a pre-filled syringe. If there was an air bubble in it, you flick it and you let the air bubble go to the top. It's not going to come out, but that creates an airlock. So I'm going to be giving this to her on her love handle. Okay. Okay. Could you tell your mother to turn over for me, please? Okay. Thank you. So I would cleanse the area from the inside out, bullseye. Trash. Here's my syringe, pre-filled. It goes at a 90-degree angle. You push the plunger until the medication is all the way in. You do not rub it afterwards so it doesn't irritate. I put it in my sharps container. Okay, take off my gloves. Trash. Do hand hygiene again. Okay. Okay, cover the patient for patient privacy and comfort. Okay. All right, Miss Smirnoff, are you on the line still? Yes? Okay. Can you ask your mom if she's in any type of pain for her to rate it on a scale of 0 to 10? Okay, no pain? Okay, that's great. All right, do you have any questions for me? No. No? Okay. All right. Well, I'm going to leave her call light here for her. And here's her water. Okay. I'll be back to check on her. Is there anything else she needs? No. Okay, very good. All right, so I will do hand hygiene. Please let her know that her call light is right here for her to call me if she needs anything at any time. If she needs help to go to the bathroom, she needs to sit up slowly to avoid, because she may be feeling dizzy. Some of these medications may cause that as a side effect as well. So I would like for her to call me if she needs to get up. Okay. All right, thank you. I'll be back to check on you. Okay, here I needed to palpate after auscultating.